Hello and welcome to another evening of frank conversation. This is Hard Copy coming to you from our studios in Abuja. I am Terry IKUMI. The Joint Health Sector Union is on a 7-day warning strike. Let me remind you that we're still in the middle of a pandemic. A meeting was held between the union and the federal government, but that did not stop the strike. The dangers associated with this strike cannot be overemphasized. Ultimately, lives will be lost. Now, despite commendations to the federal government on how it has handled the pandemic, some still blame the federal government for the strike. The federal government, on its part, believes that the issues raised by JOHESU can be addressed much later. So what are these issues? Fixing of structural and infrastructural decay in the health sector, payment of health workers' hazard and inducement allowance, corrections in the errors in the COVID-19 allowance, among others. Well, my guest on Hard Copy tonight is the Minister of Health, Dr. OSAGIE EHANIRE. Also, beyond the strike by JOHESU, we'll also discuss how the PTF is handling the pandemic and what the drop in numbers means for the country. Dr. OSAGIE EHANIRE, welcome to Hard Copy, and thank you very much for finding time to speak with us today.
Thank you. Thank you.
I think it's very worrisome that the same reasons for which the NMA and the resident doctors went on strike have repeated themselves in the JOHESU strike. And it's also interesting to some that instead of the federal government addressing these issues, the federal government is appealing to JOHESU to call off the strike. Does the federal government think that the demands are unreasonable and ill-timed?
I would not say that those demands are unreasonable, but they are ill-timed because a large number of them, as you will see, have their origins from much earlier. And the situation we are in now does not call for withdrawal of services when we are in the middle of a pandemic. We do not want to be the only country in the world where health workers are withdrawing their services in the middle of a pandemic. It does not look well for the whole country. Many of the issues they have said can be resolved. The ones revolving around pay, hazard allowance, particularly inducement allowance, those ones are relatively new and are subject of negotiation.
Honorable Minister, I just want us to be on the same page now. And based on what the JOHESU said and how the meeting between the federal government was deadlocked, I'd like us to be clear. What exactly was the federal government's proposal to them at that meeting that prompted them to still embark on that strike?
It is not the federal government's position to actually propose, but to listen to their complaints and address those complaints. The negotiations and conversations are still ongoing as we speak. They are being handled by our Department of Hospital Services, and most of them, as we have said, are such that they can be addressed in a negotiation without a strike, so that we don't put the lives of citizens at risk, and especially since many of them are of long duration. So the response of the federal government is to say, call off the strike, let us sit down and talk about these things. There are quick wins in there. We can address the issues of hazard allowance if there have been some errors in computation of the beneficiaries and the inducement allowances. We can address those ones. In fact, I have received a list of such names that are said to have been omitted, and I have minuted them on for onward processing. That is the position of the federal government.
Let's talk about the hazard allowance, which you mentioned. According to them, they say that there was a mistake and it was contrary to what was initially agreed on. According to them, paragraph 1A says that anybody that was earning 5,000 naira should be given 50% of his consolidated basic salary as hazard allowance. But they said that the federal government was going to give 10% to some of its members, and they rejected that agreement because the people said that's not enough.
Well, the benefits were the subject of quite a discussion with the unions themselves and also with the within the PTF, and they were arrived at following that. But for a large organization like the health sector, it is not very easy to say that you have covered all those who are eligible to be covered. There are some beneficiaries or potential beneficiaries who came out and said, look, you forgot about us, we want to be included. So those ones are being taken care of. But as far as the arrangements are concerned about the percentages, they followed a particular line of those who are directly inside the isolation centers and handling patients. Those who are not inside the isolation centers and are eligible to see anybody who might be COVID positive. Let's say if you are a consultant, for example, who are in the administrative sector, who work within the environment, or in fact see outsiders are exposed to the same risk as general citizens. Those are all arrangements that and plans which were laid down as guiding principle, but they are open to a discussion. And if there are things that the Joint Health Sector Union think that were not properly captured, in that it was graded in the estimation of exposure to risks. Those who work in the environment, with the fact that they work within a hospital, are at a certain kind of risk, but lower risk than those who are directly consulting and seeing patients. So if you work in a hospital environment, your exposure is probably not much more than a person walking along the road or walking in the street or somewhere, but it is definitely because we are in a hospital environment. So there's a consideration for that. There's a consideration for those who work inside the isolation center, who are directly tending the patients in the isolation centers who are already known to be positive. So those things are all graded and they were considered in the original agreement.
Is the union aware of this?
Of course, the union they are aware of it, but the complaints they have had is that some of their members were not captured or in certain hospitals, and they should have been captured. So that is the grounds that is being taken care of. Or those who think that they should be in a different category of classification, well, those are things which are subject to negotiation and due process.
Well, let's go to some other things that they mentioned. They said that the federal government withheld the salary of its members for some time now on the no work, no pay directive.
Well, the no work, no pay is a standard regulation. The International Labour Organization, ILO, recognizes it that if you didn't work, you do not get paid, and you do not ask for remuneration for an effort you did not put in. So it's not just an invention of the government. It is a provision within the international labor law. So those who are demanding to be paid for time they didn't work, that is not the standard that this government employs. So I don't know why that should be coming up at this time. But again, it is something that happened in the past.
Is that open to negotiation as well?
Well, I would not say that is for those who are negotiating. The Minister of Labour is himself quite emphatic in advising us that it's written down in the international labour law and also in the provisions, in the instructions from the government, from the presidency, that says that these are the rules, and those who embark on the strike know the rules. They know very well that these rules apply, and therefore should not embark on a strike and then ask for the rules to be bent. Those are things which I believe the Labour Minister will still advise us on, and looking for the way forward.
Honorable Minister, there's a statement credited to you that striking health workers should be replaced with core members. Is that your true position?
That is not a correct statement. We didn't say they should be replaced. What we are saying is that the Ministry of Health is the custodian of health. We are obliged to provide health services to all Nigerians at all times. Now, you must add that sentence, that so-called quote, to the sentence that we have made, that striking is not the best way to resolve issues if you are working in the health sector. Striking increases the risk to people's lives. And when the strike looks to be so dangerous, we look for additional support, help, and protect people's lives. It is not because it is being punitive, it's because we need to protect the lives of people who might come into the hospital and cannot find service. It cannot be the desire of our health workers that people should lose their lives over this negotiation. It cannot be their own desire. I know them very well, they are my friends. So it cannot be their own desire, but in critical situations, where we find that we are getting overwhelmed and there are no workers, we have said that we should bring in youth corpers and volunteers and all those who are willing to save lives of citizens. It is not to replace, but to save lives of those whose lives might be endangered by the fact that a certain worker failed to show up.
I'm curious as to what would change, considering that it's the same conditions that the JOHESU members have embarked on strike that the youth corps members or volunteers will face. Will they be paid hazard allowances? Will they be provided with personal protective equipment and things like that, considering that they would be exposed to a COVID-19 hazard?
Yes, I just answered that by saying that the question of personal protective equipment has been taken care of. They are everywhere. We have an abundant stock, and they are supplied to all health institutions and to all state factories any longer. We have enough personal protective equipment. But as far as the allowances are concerned, they have been paid to all those who are eligible, and where there are errors, where errors are pointed out, we take care of them. But as I said, COVID is a global phenomenon right now. It is a problem for many countries in the world, very many countries.
I just want us to stay on the options of replacing or temporary replacement of the striking health workers. You say that volunteers and youth corps members would be temporarily employed to save lives. But I'm also curious as to life insurance, because that's also one of the reasons why the resident doctors went on strike. Life insurance for their members. Would you also be giving life insurance to the volunteers and youth corps members?
Yes, a life insurance is a standard life insurance under the Office of the Head of Civil Service, and there are special insurances that have been provided. And there is an insurance company that has been so generous and so kind as to provide free life insurance for those who decide to offer their services and volunteer. And I do, again, want to emphasize that we commend all those Nigerians who volunteer their services. If a person decides that, yes, my country is in trouble, let me help. Even if you are retired, I can still help. Or if you have turned your attention from the practice of the health service to something else, you decide to come back to it, just to help in a tight situation that we are in, that is laudable. Persons like that should be really appreciated and recognized.
Let's talk about the deficit in the number of doctors now. There's a statistic that reports that there's one doctor for every 5,100 Nigerians. Is that the case?
Well, we have to look into the statistics again because it varies constantly. I cannot give you off the cuff now how many to each. But Nigeria has many medical schools. I also can't give you the number of the cuff. And we are producing graduating doctors a lot. We do have quite a bit of attrition of doctors who are leaving the country. But I think on the whole, the balance sheet shows that we are having some good increase in the number of doctors, the ratio of doctors to patients in the country.
Is there a number of doctors that you're aware of? How many doctors can you say that we have in the country, registered doctors?
Well, we have to look into the statistics. That is not something that can be given off the cuff with certainty.
I ask
how many doctors we have in the country.
I ask this because it's in line with what you just said. A number of doctors have left the country for greener pastures. How does that affect the country's health structure?
It does have an effect in the sense that the services are reducing. Rather, the number of health workers will be reducing. And we have received applications also from some of our hospitals to replace those who have graduated from their specialty training. And we're also graduating medical students, mind you, who come in for their internship and for youth service and so on. So there's a sort of a flow that brings doctors into the system, and nurses, and pharmacists, and the medical laboratory scientists. We are all together, people are coming to the service, and those who I have seen some of them leave. We do not have reliable statistics yet as to how many have left or are leaving, but the restrictions in travel of late has possibly not allowed as many as would probably be leaving to go. But we are appealing to all those who have obligations, who have, for example, signed up for bonds or training for scholarship to fulfill their bonds. There are some who have bonds with state governments signed bonds and were trained at state government expense to fulfill their side of the bond and before they decide on what to do with themselves.
Coming up, how's the PTF handling the COVID-19 pandemic? And what does the drop in numbers mean for the country? Welcome back to Hard Copy. My guest is the Minister of Health, Dr. OSAGIE EHANIRE, and we're discussing the issues surrounding COVID-19 and the JOHESU strike. Honorable Minister, I had a conversation with the President of the Resident Doctors Association, and he said that beyond looking for greener pastures, that the doctors are leaving the country basically because it's a more convenient environment where they have better equipment to work with. Is that the case?
Well, better equipment. I don't know how many have been abroad to see the equipment before they decide that they are better. But the point is that all countries are at various levels of development, and we are not bad off at all here in Nigeria compared to other countries, other developing countries. We are a developing country in the long run, what they call a lower middle income development. And although we are using this opportunity now to carry out some upgrades in our health system, to improve our health system, and to invest in it, to call for investment, particularly from the private sector, and carry out huge reforms that we take the health sector forward. We do have equipment. We are not 100%, but we are not that bad.
So let's go to the PTF now and your work. You've been commended quite a lot for the work you're doing with the fight against COVID-19. The numbers are going down in Nigeria, and it's quite worrying because we're discharging patients, and some other countries are recording high deaths per day. What are we doing right?
This COVID is a new virus, as it's called, and we are responding to the development, to it as it evolves along the way. We are also watching other countries and paying attention to what they do and learning from them. Some of them are actually making what we think are mistakes, and others are doing things right. There are some countries that are suffering what they call a second wave right now, and because they probably took certain steps that led to that, we try to avoid those steps. And remember that Nigeria was one of the first countries to begin preparing for the entry of COVID. We did that very early at the onset with the hotel services watching all entry points into the country and the NCDC doing targeted testing. So we still do not have any reason to rest on our oars. We do not believe that we are out of the woods. We believe we must remain vigilant and continue to pay very good attention to surveillance, to monitoring all activities and information that we get, and doing targeted testing, particularly targeted testing. We watch for the symptoms, and we also do contact tracing. So those are the things which we believe have helped us so far. I want to continue with those strategies and appeal at the same time to all stakeholders, the various ministries and departments, agencies, and the partners, and also state governments who play a significant role in this response to continue to work with us and to continue to help in cooperating to see that the figures remain low.
That we haven't peaked yet, basically because we've not tested enough. We can't even say anything about that now, considering the fact that some states are no longer submitting samples. Are we still expecting a second wave?
I cannot say that now, but that is something that we definitely want to avoid. And in our brief yesterday, I did appeal that states should increase their testing. 17 states only submitted their reports yesterday to NCDC. I believe others submitted later on, but at the time of reporting, only 17 had done so, which is not to say we're assuming that only 17 tested. But we do want to see an improvement in the testing going on, particularly in the small towns and more rural areas, to be sure that there are no cases that we are missing in those areas. We are also, as I said, doing a lot of surveillance to listen very closely. There are reports of mysterious deaths at any place. Up till now, we have not heard of any. But the appeal is still to be very vigilant and not be confident and not under any condition to believe that we have been successful, because we are not even sure that we are flattened the curve yet. We want to continue to act as if we are in the middle of the pandemic and respond with the same vigilance and with the same seriousness.
Very well, then. Now we're winding down. What's the level of involvement of the PTF in the Edo and Ondo elections coming up? Because this is the first time we will be conducting an election in a pandemic. How are you involved to ensure that the COVID-19 protocols are observed?
INEC has been advised, and we have also provided them with some equipment, personal protective equipment and testing equipment, and some protocols for elections, which were announced yesterday by PTF. The Constitution does say that elections should be held. It didn't foresee a pandemic, and the fact that these elections are being held now, and we are provided the guidelines for it, is also a test of the system. And we are watching very closely. I've put all the hospitals on alert to watch for increases in the number of people who are presenting at the A&E, that is the Accident and Emergency Center, and the symptoms that are coming with, and to report all those things immediately to us so that we can respond immediately and send teams in there. So there is a high degree of alertness and awareness that has been created in creating the grounds for this election to take place as safely as possible.
The medical doctors have also complained that they were not involved, they've not been involved so far in the PTF's activities. Is that true?
Well, I'm a medical doctor. The Minister of State is a medical doctor. And the PTF is not carrying out any treatment. It's just working on policy and the guidelines and bringing together all the other ministries who are in any way involved. The Ministry of Interior in there because they are the supervisors for the Immigration Department, which is the entry point, and also they take care of the reform centers. The Ministry of Foreign Affairs is also involved, and the Ministry of Aviation, of course, the Ministry of Humanitarian Affairs. So the PTF actually works out the guidelines and the framework for overall way of addressing the pandemic. The actual medical side of it is conducted within the Ministry of Health and working with our agencies. We have a very powerful ministerial advisory committee that advises us 3 times a week. It is headed by Professor Oyewale Tomori and a lot of about 12 experts in public health and infectious diseases and laboratory medicine who advise us on the way forward.
Just before we go, you at the beginning of this pandemic did state before a House of Representatives committee that you did not think that the health workers deserved a hazard allowance because they were just doing their job. Seeing how this has turned out now, the magnitude of this pandemic, do you still hold that position?
That is not true. That was never the statement. I think if you do say so, then you have misquoted me. I didn't say they didn't deserve a hazard allowance. At that time, I didn't say health workers. Okay, at that time, nobody knew the level of the epidemic or pandemic. And the question was about those persons who take your temperature, who measure your temperature as you go into an office. Right now, coming to this ministry, there are people who take your temperature, just routine screening. And the people who point the thermometer at you to take the thermal screening, those are the ones we're talking about. We're not talking about core health workers.
I remember vividly, I think I heard the question clearly from the Speaker of the House of Representatives when he asked you if you felt that health workers deserved COVID-19 allowance, and you said they were just doing their job, that it was still in line with their job. I recall that clearly because I was at that hearing.
Well, I also recall that at that time the subject matter was about those who are doing routine screening of people who are passing by. And if you got that question, you probably got it wrong.
Honorable Minister, I'd like to say a very big thank you for your time. Thank you for speaking to us on Hard Copy.
Thank you very much.
Well, that's Hard Copy today. Send feedback to the email address and social media handle on your screen. Remember to catch this and past episodes on our website, channelstv.com, and our podcast on channelstv.com/podcasts. I am Terry IKUMI. Goodbye.